Just days ago, India's top officials argued that there was nothing dramatic, quote unquote, in the country's COVID death count. Well, the World Health Organization is arguing otherwise. In a report that India was initially opposing the release of out moments ago, the World Health Organization is, of course, talking of an over 14 million excess mortality count globally. For Indians, where the top officials have been arguing that the death count and the methodology to establish it is robust and sound, the World Health Organization is arguing otherwise, suggesting that 7 to 8 times more Indians have died from COVID than the country has cared to count. In fact, we do have a precise number now of 4.7 million excess deaths in the 2 years of the pandemic. Translated simply, excess deaths simply mean people dying and in an all cause mortality. That is what the excess death figure actually references. And to understand this huge dramatic gap between what India is presenting to the world and what the World Health Organization is arguing, let's introduce our panel of experts today. We're joined by Dr. Ishwar Gilada. Dr. Gilada has been at the front line of the COVID pandemic here in Mumbai for the past 2 years. We're also joined by a well-known epidemiologist, Professor Prabhat Jha. Professor Jha was part of the technical advisory review committee that looked at the WHO numbers. Of course, he had a very, very important study of his own, also outside of India, mirroring in some ways the broad trajectory of the WHO findings. We're joined today by Ruchika. Ruchika lost her father because of oxygen shortage in the hospital where he was being treated. Remember, many of the oxygen shortage deaths have not been counted by any of the states, and these are just an example of COVID deaths that have slipped through the cracks of officialdom. And we're also joined by PKD Nambiar, who's of course a policy analyst and a political analyst. Thank you very much. I'll start with you, Professor Jha, because you're the one person on this panel who's had a chance to review these numbers. These numbers are out moments ago. This report did somewhat leak before. There was a suggestion that the numbers would be 8 times higher than the official count. India, in fact, opposed the release of this report. First, I would request you to take us through the broad finding, what it tells us. We have a number, 4.7 million excess deaths. If you had to explain that to the layperson, how would you break it down?
Certainly. So the WHO has run an analysis which uses data from all countries. They tried to get data for 194 countries. And the analysis is a reasonably simple, at least in statistical terms, analysis of the excess deaths. And excess deaths has a very simple idea. If you compare periods when the pandemic was raging to periods when there was no pandemic, any excess that you have in deaths should almost all be attributable to the infection, even if COVID was not confirmed in that death. So, and you also must remember that COVID doesn't just kill through infections of the lungs, it can kill through heart attack or blood clots or kidney failure. So in that context, it makes sense to focus on excess deaths. And so this is an imperfect measure, but a robust one. And what the WHO found is that worldwide, there were 15 million excess deaths compared to 6 million officially reported COVID deaths. So that's a gap of about 9 million missed deaths. And then of those 9 million missed deaths, something like 4 million, close to half, were from India, because their estimate for India using the same approach was 4.7 million deaths, with a range between 3.3 to 6.5. Those are higher than our estimates, which were around 3.5, but broadly consistent with what we found. And now, importantly, the WHO data for India were not simply models run from other countries and applied to India. This is what the Government of India press release suggested, but it's not true. The researchers at WHO used 17 states' data, actual government data, to make those estimates. And in fact, Interestingly, the 2020 data from the civil registration has been released, and I was surprised to see an editorial by the esteemed colleague Dr. Vinod Paul suggesting that confirms that India actually hasn't had lots of excess deaths. If you look carefully at those data, it suggests that India had about an 11% excess deaths in 2020 versus 2018 and 19, very much consistent with the WHO estimates. And if you look at the same data just released 2 days ago, Maharashtra, which we all know was very affected, at a 19% excess in 2020. Now, this is all before, these estimates so far are all before the killer wave of April, May, June 2021, which unfortunately took so many lives, including of our of family of our people on the show. So these estimates are just for 2020 when things weren't as bad, and that still suggests a significant excess. And Maharashtra, as we all know, was very hard hit, even in the first viral wave, and there's a big excess of deaths there. So the logic is you compare against previous periods, and any excess is probably due to the COVID infection.
Yeah. So the WHO in its press release, this figure of nearly 15 million is of course all mortality deaths, but it says COVID associated deaths. To be clear, these are not all deaths from COVID. Similarly, 4.7 million excess deaths for India, Prabhat, are not all deaths from COVID. It is basically talking about how many more people died from any cause, and it is assuming that in the pandemic, a majority of these would be COVID. Am I summarizing this correctly?
That's correct. Yeah, that's correct. You can say that, okay, if someone during the peak months or peak weeks um, died of, let's say, a cancer, then that wouldn't necessarily be COVID related. But you could also argue that, well, if COVID was so bad and hospitals were flooded, then perhaps some care in that time period might have at least averted that death for some time period. And it's also true during COVID, some deaths would go down, like road traffic injuries. Now, the WHO method took all of those into account. So, what you're seeing mostly is that the big excess of deaths was very much due to COVID, almost predominantly COVID infection, even if COVID wasn't confirmed in that particular death.
So to be clear, we are saying 8 times more Indians, Professor Prabhat Jha, died from COVID than officially argued by India, and 9 million globally more people died in the pandemic years, possibly most likely from COVID, than the world has declared. So this isn't just about India. Why then do you think India has responded with the kind of sensitivity it has? Vinod Paul writing in the Indian Express saying nothing dramatic in the COVID figures, when in fact there is a dramatic gap if the WHO is correct.
You'd have to ask that of the government. I think it's actually short sighted to try to deny these deaths. I mean, they're important for moral accountability purposes. They're important as also to understand why was there so much variation in the death rates, even within different parts of India. And from that, you can also get a sense whether the control programs, the vaccination, which has been an outstanding success in India, is actually working. So you cannot fly blind. India would never play a cricket match with um, a a mask over its eyes and saying we're winning the game. It doesn't work that way. So you need data to be able to manage the pandemic. So I think the Indian government position has been unfortunate, but very short-sighted.
Yeah, and I'll come a little later to the comparative death sort of mortalities in nations. The United States has officially hit a 1 million mark, and that's just the official figure. Before I get Dr. Gilada and PKD Nambiar, just a personal thought from Ruchika. Just to put it into context, in India, a number of people lost their loved ones because in the hospital ICUs there wasn't enough supply of high flow oxygen. The oxygen supply ran short. Ruchika, as you and I have been talking over the year and we've been tracking this on the ground, this either meant that people were turned away from the closed doors of hospitals that refused to admit any more people with no oxygen supply, or people who might have recovered well otherwise just died because there was no oxygen. Now, the hospitals and the governments have not tabulated these numbers. Just an example of people who have not been counted. Ruchika, your thoughts when you look at this WHO report today saying that 8 times more Indians are likely to have died from COVID than the official figure suggests?
Yeah, hi, Barkha. So the main thing I would like to point here is I don't know if the government officials have taken note of the people who died on the streets, who never got a chance to even reach the hospital. And then most of the hospitals were actually full. There was no space at all. And even then, the people who were admitted, I think the hospitals were already running oversized. There was no space in the sense that the hospital was already doubled the numbers they were admitted, and which is why the treatment was not that good. So, would you take into consideration that the hospitals were already more than full, and then people were turned away, and so many people died on streets, and so many people died like they weren't able to arrange the ambulances as well. So, where would those numbers go? Like,
And can I ask you, as a daughter today who's been fighting, I know your family's in court actually demanding transparency on the oxygen shortage related deaths. How do you feel as a daughter today at a very personal level that there is such a wide gap between the figures put out by the government and the figures put out not just by the World Health Organization, but by scientists such as Professor Prabhat Jha and others? As a daughter, what would you say to the nation today? What would you say to the government today?
um, I am basically really disappointed in our government, and which is what we have been facing till now. No, right till now we haven't been able to register the FIR. So it's everybody told me when I started this fight that you will not get anywhere, and this is like it goes to show me that actually this is where we are not going to get anywhere, because it's just the my fight is from pillar to post, and I think I'm going to run in circles, but nobody wants to take the responsibility, and nobody cares. It's just numbers for them, and even the numbers are not correct. So I'm just ashamed to say that I just stand nowhere, and I'm just really disappointed, and I don't know where to turn.
And you're saying you wanted to file a criminal case against the hospital, and you haven't been able to do that. To be clear, this is one of many hospitals where the oxygen supply was not provided. I even came across in my reporting people who were made to sign waivers saying if people died from the absence of oxygen or the lack of oxygen, it was not the hospital's liability. Doctor, and my heart goes out to you, Ruchika, and I'm really sorry for everything you're experiencing right now. I'm also a daughter who lost her father to COVID, but I didn't have to go through these multiple struggles that families like yours had to go through. Dr. Gilada, I know you don't agree with the WHO figures, so let's bring you straight in. Go ahead, sir.
Basically, everybody in India or everywhere in the world, they know that there are excess deaths due to COVID. But the multiplication factor is important. I thank WHO for clarifying, because earlier the report which was leaked in New York Times, I don't know who played the mischief, whether New York Times or WHO or anybody on the WHO committee, saying that 15 million are excess death in the world because of COVID, and then attributing India to 4 million COVID excess deaths. Now they clarified that, saying that they are all cause mortality excess death. So if you look at all cause mortality excess death, usually COVID is attributed to almost 50% of them, maybe 40, 60, 60, 40, whatever. But by and large, they're 50%, because there are a lot of people, particularly in the second wave, they died of cardiac problems, cancer related issues where they could not reach hospital. There's a study of Tata Hospital to show that a lot of people could not reach for chemotherapy. So whatever factors are there, they should be attributed properly. However, if you look at the total figures uh, in the globe and the case fatality rate, global case fatality rate is 1.2, India is 1.3, America is 1.3. So India is no different in case fatality rate. If you look at cases, India is contributing 9% of global cases globally on record. There may be more here in India, there will be more everywhere. So if India has not shown so many people were dying which were not diagnosed, which were not properly treated, that was not the case. That was case everywhere, and similarly case was in India. But all cause mortality attributing every death to COVID, that is so dead wrong. And what is WHO saying? That out of 10 deaths, 6 are listed globally, 4 are not counted. In Africa, out of 10, 9 are not counted. And India, out of 8, 7 are not counted. So they are squarely putting India at par with Africa, which is not the case. India is far better and greaterly managing the cases than Africa. So I think you put everything in perspective. We would agree with your estimate, which you have done earlier, that excess death could be 2 to 3 times, maybe 4 times more than that, but never 8 times more than that. And whatever government of India or government of India officials say, they may say in defense. But if rationally accepting the figure, and I respect Dr. Prabhat Jha, I have known him for at least 30 years now. He will not be wrong. But WHO or New York Times, they definitely erred in saying that 15 million
Okay,
were excess COVID deaths.
you are drawing that distinction between all cause mortality and COVID mortality. You heard what Professor Prabhat Jha said, that more or less a bulk of those deaths would have been from COVID. Let me ask you the first question: do you believe India's COVID deaths have been undercounted significantly, even if you don't agree with the WHO figures, Dr. Gilada?
Deaths globally, including India, are undercounted. So India is no different than any place in the world. And in proportionate deaths also, which are not counted, I don't think India is proportionately different than the rest of the world, whether it's America, Italy, everywhere. And everywhere they were, therefore, they were looking at what is the percentage of death which are extra. So in Maharashtra, they looked at not 19%, but 16.6% more than 2019. So probably 2021 deaths were not so much, but 2020 definitely deaths were extra. And out of those extra deaths, maybe you can contribute 50% or 60% or 40% to COVID. But the excess death of COVID will come from the chunk of extra deaths. They will not come from extra. There are no extra deaths. The extra deaths are
Okay.
there,
Okay, I'll
out
get
of which you
PKD
can
Nambiar.
contribute.
I'll get Mr. Nambiar to react in just a moment. Professor Prabhat, if you like a brief interjection there. Dr. Gilada is drawing a distinction between all-cause mortality and COVID deaths and saying that even if many more, maybe millions, have died from COVID than we know officially, all the excess deaths cannot be attributed to COVID. You would say what, sir, Professor Jha?
Deaths can be attributable to COVID, and the logic is pretty simple. Yes, during the pandemic weeks, the absolute worst weeks, you will have some deaths that would have occurred anyway, but maybe were accelerated. Let's take someone with cancer. But you'll also have some deaths that go down, such as road traffic injuries. So those balance out, and what you see is the excess deaths are almost all due to the infection. If it were not the case, then if you compare the excess weeks versus the non-excess weeks, then they shouldn't be so different. And if you look at the patterns of those, they very much pattern after the reported official COVID case counts. So there's just absolutely no reason to think when you've got such a big excess in deaths that it's not due to COVID. And I would suggest to your viewers do a simple experiment. Go out and ask in your neighborhood in India, just ask 10 houses, did they have a death in 2021 or 2020? And normally you would find very few houses would actually report that. But I think if you do, you ask 10 houses and you'll find many of them actually did report a death. And that only can be explained by the COVID pandemic. There was nothing else going on really that could explain such a large number. How much is the excess versus the COVID? Well, is it 90%, 80%? That's less determined. But the majority, the vast majority, certainly are COVID related. So I disagree with my esteemed colleague, Dr. Gilada, that the undercounts in India are modest. They're actually quite substantial. I think they're at least about 6, 7, 8-fold higher than the government officials.
Okay, let me also just add to this, and then let's bring in PKD Nambiar, Mr. Nambiar, that from my experience, whether you see these images that many of us want to forget of people lining up desperately outside gurdwaras to be given oxygen, whether it's families like Ruchika, whose families died, more than 20 in a single hospital at a time because the oxygen ran out, or rural India, where those who could not get a COVID test were not counted. But as Professor Prabhat Jha said, if you stepped into any village, they were all reporting a spike in sudden deaths in the months of April and May from COVID like symptoms. The fact is, we all seem to agree that the deaths have been undercounted. We all except the government. Mr. Nambiar, what would you say?
I also believe the same. And I'm sure that in such a large country, just a 500,000 or a little over a 500,000 is the government's number. And that cannot be the accurate one, there is no doubt. But having said that, in the January, we got a Lancet report which saying it's about 8 times more. And then followed by in the March, there is another report which is saying 10 times more. And today, there is another report of WHO. So I think there's a number of playing with the number by various agencies are sometimes I feel that it is motivated. As I said that, of course, it cannot be the actual number what we all have it. But also, I also wanted to make a point. Maybe Dr. Gilada may agree with me. The most of the hotspots, if you really look at it, except the UP, Bihar, or some of these belts. For an example, my home state, Kerala, wherein I can promise you that one of the best health system, there won't be even a one COVID death would not have been unrecognized or not noticed. It may have been really been mentioned properly. It can go here and there. Same is even if it is in the Maharashtra, for an example, a very, very prosperous state wherein most of these deaths have been really counted to a great extent. I can understand in UP, for an example, or some without having any political bias to anything, or a Bihar, or some of those states may have had definitely some extra numbers. Also, you need to understand that most of our COVID related challenges were in the cities, whether it is Mumbai, Delhi, or in many of those places. So of course, as Ruchika and you have a story, I also have a story wherein I was having COVID and I had to take my neighbor who was almost dead just because of a cardiac arrest, but he was actually because of the COVID. It's only because of the COVID. He was not having any COVID, but it is not mentioned anywhere as a COVID death. It is a healthy, hearty
But
guy.
that's my point. That Mr.
Yeah. So
Nambiar, that
that is the reason I
people
am
who
saying that
died. Yeah, sorry.
the
Go
number
ahead.
I'm sure that will be much more than what we have the government numbers, and the central numbers what we get is all being provided by the state governments. So I remember that the Vinod Paul he was asking the state governments multiple times, the health secretaries and the chief ministers, to make these audit these numbers and better. And also note one more thing: almost every state governments in the country had promised some kind of an ex gratia amount for the COVID deaths. So most of the people, when it comes to getting these reimbursement or these benefits, would definitely go and file their death information on the government. This thing that will also bring a lot of clarity. But unfortunately, we cannot have a benchmark way of counting by WHO or any other.
And India's official figures say that approximately 475,000 more people died in 2020 compared to 2019. This is the data that India has officially released. But you make an important point about the states, because the states have not reported back, for example, oxygen shortage deaths to Parliament, and which is why at one point the central government actually got up in Parliament and said zero deaths related to oxygen shortage. Yes, and that's such an insult to families like Ruchika who've been fighting legally since then. Professor Jha, if I can ask you to come in and tell us whether there are any patterns that emerge globally. For example, we know, you said that 9 million all-cause deaths missing globally. I'm using the word all-cause to be very technically correct. You believe that most of these would, or a majority of them would be COVID associated. So does clearly the WHO. Dr. Gilada disagrees. India has so far reported the third largest number of deaths after America and Brazil. If we take the undercounting into factor, does that change? What do we know of India's performance compared to the rest of the world in terms of mortalities?
Well, you have to understand, of course, that missing deaths do occur in a variety of places. So, for example, Russia has 1 million deaths, according to the WHO estimate, but only reports 300,000. Indonesia is similar in reporting deaths or having lots of missing deaths. But most high income countries, the gap between the excess and the COVID reported deaths is actually quite small. Take Italy, for example, their national figures for COVID reported deaths was 160,000. The WHO estimate was 160,000. So, and the way the estimation works for WHO is they use actual data. And then for places where they don't have data, they extrapolate. In the case of India, they used actual data from 17 states from the civil registration and extrapolated. So let me come back to the point that has been issued by the Indian government. They released the 2020 data, and in it, the claim is that versus 2019, there were only roughly 4 lakhs more death.
Mm-hmm.
And then Paul, Dr. Vinod Paul, the esteemed member of the Niti Aayog, has said that, well, those aren't all COVID deaths. So our numbers are about right. Well, that's actually not correct. The best way to estimate that is to compare the 2020 deaths against an average of the previous years. So if you take the average of 18 and 19, 2018 and 19 deaths, then India had 8 lakh excess deaths, not 4. And then if you look at, so that's about, and that's exactly the same total as WHO has arrived for its models for 2020. So strangely, the Indian CRS release has confirmed the WHO findings for 2020. If you
That's
look,
interesting.
yeah,
Yeah.
if you look then at a state, and we all know in 2020 that Maharashtra in particular was very hard hit. They had something like, excuse me, I said, yeah, for Maharashtra, they had 8 lakh deaths. In the earlier years, they had
Yeah.
about 6.7 lakh deaths. So the excess there is 19%. So that's exactly what you'd expect. A greater excess in Maharashtra because it was hard hit in 2020.
So you're actually saying that actually the Indian data, when looked at, as you just described it, would actually mirror the findings or the direction of the WHO findings. Dr. Gilada, let's bring you in quickly.
Barkha, see, basically, excess death everybody is accepting. What we are not accepting is if in the globe they have 140% excess death. So they're saying 6.2 million has become 15 million. So 9 million excess death. But for India, they're saying 0.5 million has become 4 million. So from where do you get such kind of calculation? So this is just a motivated calculation. This cannot be a scientific calculation at all. To do that India has 8 times more deaths, you will have to prove that Indian management was bad. India had really allowed people to die. Nothing was being done. I think India fairly managed well as compared to rest of the world.
But Dr.
Barring
Gilada,
that
but
particular
you
period of
know
a
the
month or two.
oxygen. Yes, you know
We
the
know
time.
see, Barkha, we know everything. Now, even if in Maharashtra you attribute all 1.1 lakh extra death to COVID, still will become 3 times more. Maharashtra has said 50,000, you're saying 1 plus 1,
So can
1.1 is
I
added.
ask you this? Can I ask you this? You don't agree with the range, but do you agree that a significantly higher number of Indians have died from COVID or COVID related issues? Because, for example, if you had tuberculosis and you couldn't get a bed in or treatment or an ambulance because everything was taken up by COVID, would you count that as a pandemic death, Dr. Gilada?
No, that will not be counted as a COVID death. That will be called as an excess death, which is non-COVID, but happened because of COVID pandemic. You cannot count them as a
That's
COVID
right.
death. When you are
That's
counting
right.
COVID death, yeah. So therefore, if we are counting COVID death, yes, we agree the deaths are more, but the proportion may be 2 times more, 3 times more, highest 4 times more, not 8 times more. So
Okay,
that
okay. Okay. Sorry,
my whole
complete your
argument
point.
is you cannot equate India with Africa. Now, Prabhat said for Russia, they're saying 300,000 is become 1 million. So 3 times more. But in India, 8 times more. And we all know that Russia has been suppressing facts. We all know that China has been suppressing facts. But India was not suppressing facts. Yes, all-cause mortality rate or the cause of death is not counted in many states. So you have to
Okay.
extrapolate. We
Can,
understand that.
I'm sorry. I have just a minute and a half left. So I'm going to ask everybody, the remaining people, to make 30-second comments. To you, PKD, 30 seconds, and Ruchika, and the last word to Prabhat. Yeah, PKD.
No, I think there is one thing is very clear. There was excess death more than the number what the government is saying. But putting a question mark on the various reports of on various stuff, whether it is the freedom of press, whether it is the democracy range. So a series of reports are coming from the Western world against India, which is really alarming. And I think that let us definitely, as the world has failed, we too have done little bad during the COVID management, not the way it is being portrayed. I have another suggestion too, because since two doctors are there, I am more worried than the COVID. What happened is now, if you go to any hospital, to a government hospital, to the big 5-star hospitals, it's rushed like anything. I think the post-COVID effect is really hitting hard. You go to any of the big hospitals, so I think
Yes.
there is another pandemic is on the
I
words.
mean,
May not
I
be
mean,
COVID.
there's long
Huge health
COVID.
crisis right now.
Yes, a long COVID has not been fully understood, and there are all kinds of ailments and complications being reported after that. That's another subject for another time. Ruchika, I want to come back to the pain that you're feeling today. And what you said really struck me, that we're not even being counted. You know, we're not just numbers, and now we're not even numbers. How do you think the government at this point, the government has one figure, the World Health Organization has another figure. In those figures, somewhere is your father, your own father.
Yeah, so yeah, I would like to ask just one thing. If you are saying that the government has not been suppressing number, so my father's FIR has not been launched till now. So if they are not even filing the FIR, how is that they are not suppressing the numbers? And in just recently we heard that there are like they agreed that there was no COVID deaths, no oxygen shortage deaths, right, in Delhi. And we remember that what a hue and cry was there when tankers were not able to reach, and the kind of situation we have faced it there. And the situation there was in the hospital, everybody was helpless and nobody cared actually. And even now we are fighting, but uh, seriously, we are not counted. If you means, I'm telling you the ground reality, it's we are not counted anywhere at all.
And I
And
think it's
nobody.
important, yes. And Ruchika, I hear you. And I'm saying it's important to remember today that as we do the math and we argue about methodology and models and numbers, there are lives here, there are people here, there are broken and devastated families here, and we must be respectful of that pain. Professor Prabhat Jha, quick last word to you. One of the questions that comes up again and again is, why is there such a large variation between the different studies that's been done? But in fact, all studies seem to nudge the world and India in the same direction. And your own study did that as well. Go ahead, sir. Last word.
I think it's important to try to get to the truth. And the best thing that India could do, India, which gave the world the zero and transformed mathematics, could do is in the September 2022 census, add a simple question: was there a death in this house in 2020, 2021, or 2022? And if so, the age, sex, and date. If those data are done, they will provide direct evidence of excess deaths and settle this debate. And if that shows, in fact, as some of your colleagues are suggesting, the death toll was lower, then scientists like myself would accept that.
Okay, I think that's a fair and productive suggestion. And like I said, we must be sensitive to the fact that there could be millions of Indians, at least hundreds of thousands, who have lost lives at the very least, no matter what the range is that you finally agree on, 2 times more, 4 times more, 8 times more. That still leaves hundreds of thousands of Indians who have not been counted, like Ruchika today, who are asking, are we not even numbers? Thank you very much, everybody. There's a lot to unpack in the WHO report as we go through it. We'll have follow-up analysis, but for now, thanking our experts for helping us decode it, and a special thanks to Ruchika, who I know every time she speaks, it's a moment of deep pain for her. So we really do appreciate, Ruchika, your courage, and thank you very much. And to our audience, see you soon. Thanks for watching. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.